Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have a great show tonight. We're talking about joint pain, when to get checked, how it can be treated non-surgically, and if surgery is necessary. What are the best options? We'll be joined tonight by a panel of top experts in this field, hearing patient stories of success and taking questions from our live studio audience. Stay tuned. This is St. Luke's Health Now.
Coming up on this episode of Health Now, an in-depth look at joint pain with St. Luke's University Health Network. Stay tuned.
Thanks for joining us. Let's get started. We have a fantastic panel of guests today on Health Now. Joining me first is Dr. Gregory Carolin, an orthopedic surgeon who's fellowship trained in sports medicine. Before joining the team at St. Luke's, Dr. Carolin trained at the Hospital of the University of Pennsylvania and attended a fellowship in San Diego, California. He specializes in shoulder and knee reconstruction, including basic and complex shoulder replacements.
Well, the first thing we do when we see patients is kind of talk to them about what their symptoms are. The significance of their symptoms drives us to understand how aggressive we need to be with evaluation and treatment of their symptoms. I think shoulder issues are unique, as in a lot of patients do not understand what options are available for them. I have patients with the worst x-rays you could ever imagine, total destruction of their shoulder joint from arthritis. They have very limited motion, but they're not in a lot of pain, and they're happy with the way their shoulder is. Those patients don't need shoulder replacement. They need some activity modification, they need some anti-inflammatories, and they're very happy with their outcome. The most rewarding part about orthopedics is it's a very tangible result. We're able to help people day in and day out achieve pain relief and return to function of things that they wish to do that have been taken away from them due to musculoskeletal problems.
Thank you so much for being here.
Thank you for having us.
So, Dr. Carolin, this is a really detailed and varied subject, and before we dig in, can you help us get a better understanding of what constitutes joint pain and when someone should really go seek professional medical help?
Well, joint pain is a very common problem that we deal with in our day-to-day lives, and by definition, it is what arthritis is. Arthritis is inflammation of the joint. People can tolerate certain levels of joint pain, and everyone has an individual threshold for what sends them to see someone to be evaluated for their joint pain. All the joints of the body can be affected, from the small joints of the hand to the knee to the shoulder to the hip. And when patients start having symptoms, as in pain, stiffness, inability to get around and do their daily activities, when that exceeds their ability to perform routine activities, we do recommend patients be evaluated for those symptoms.
That's great information, Dr. Carolin. We're going to get into that a little bit more later on. Now we'd like to introduce our next guest. Joining our panel next is Dr. Jennifer Banzoff. A Lehigh Valley native, Dr. Banzoff is thrilled to return to practice medicine at St. Luke's after training in both Philadelphia and Boston. Dr. Banzoff is fellowship trained in adult reconstructive surgery with a concentration in total knee and hip replacement, fracture care, and musculoskeletal trauma.
When I first see a patient, first thing I do is just listen. I want to know about the person. I want to know how their problem is affecting their life, where they feel limited. I try to get as much information as I can from them and kind of get an idea of where they kind of want to go and take this. And I always try to treat them like they're my mom, my dad, brother, sister. And we usually start by just lifestyle modifications. What can we do? What activities can we change? I really try to pay attention to how people are feeling about it, and I get a sense too just where they want to go with it. And I think it's not a one-size-fits-all. It's definitely something that I think you need to listen to the patient and individualize things for them. After total joint replacement surgery, when I see somebody come back and they're doing well, there is nothing better than that. It's that moment that people come in and they're just doing so well that I feel privileged to do it. I feel privileged that I am able to help another human being in that way.
Thank you so much for being here.
Thank you for having me.
So when a patient comes to see you, Dr. Banzoff, with joint pain, how do you determine the best course of action?
So first thing we do is we just sit down and talk. We get to know each other. They tell me about what symptoms have brought them in, and really just what brought them into the doctor's office in the first place. Then we get some imaging. I do a physical exam on them, and then we kind of put all the pieces of the puzzle together, and we talk about what's the best treatment and action plan for them.
It sounds like a really personalized approach to your specialty.
Very much so. I really believe that it's best to kind of approach every patient as an individual and tailor their treatment plan to what's best for them.
Excellent. Thank you so much for being here with us tonight.
Thank you.
And now let's meet our final panelist, Dr. Adam Sadler, an orthopedic surgeon. He comes to St. Luke's after completing his fellowship training in adult reconstructive surgery, specializing in tissue-sparing joint replacement and reconstruction. Dr. Sadler is excited to be leading the orthopedic charge at the St. Luke's Warren campus.
My approach to patient care is truly one of a conservative manner. I try to exhaust all forms of conservative or non-operative treatment prior to offering them a surgery. Really, in my mind, surgery is the last resort. Typically, the way I like to talk to my patients about understanding joint-related problems or people needing a joint replacement is very similar to wearing out the rubber on the tire of your car. Over the years, you wear down the cartilage, and the cartilage is what protects the bone. After the cartilage wears down, the bone ends start to rub on each other and cause tremendous amounts of pain. Behind any successful patient, behind any successful surgeon, is their staff. It is a joy to go to work every single day and work with them. They are professional with my patients. They treat them as they would want to be treated, and they always welcome them with a smile. Ultimately, a pleasant experience from start to finish. The best part of this job is seeing a patient who's experienced a functional decline and has had significant amount of pain undergo a joint replacement surgery and ultimately return to their level of function and find their happiness again. That's what makes this all worthwhile for me.
Thank you so much for being here.
Thank you, my pleasure.
So before we dig in a little deeper, can you explain some of the options that you present to your patients prior to them undergoing surgery?
Sure. Much like Dr. Banzoff said, I try to tailor each patient recommendation to their specific needs and what their goals are specifically, whether it's to enjoy vacations on the beach with their family, to return to competitive sporting or recreational sporting. I base my treatment plans off their expectations and help them achieve their goals, so that can vary from patient to patient.
And there really are quite a few options out there, as I think we'll see a little bit later this evening. Excellent. Thank you all for laying the groundwork and giving us a better basic understanding of joint pain and various ways to approach it. We'll dig deeper with more from our panel, their patients, and our audience later in the show. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
I've had pain on my left shoulder for a couple of years now, I would say since 2001. It just really took my life away from me, and I needed relief, so I decided to talk to pain management about my shoulder replacement. If I had known that I was going to be feeling the way that I feel, I would have done this a long time ago. I think they have very good doctors. They know what they're doing. They're very comforting. They guide you through the whole process so that you're not going into it blindfolded. The results from my surgery have exceeded my expectations. I didn't think, 2.5 months out of surgery, that I would be feeling the way I am. St. Luke's Orthopedic Care is the best.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. I'm joined by an outstanding panel of orthopedic surgeons, physicians Dr. Gregory Carolyn, Dr. Jennifer Banzoff, and Dr. Adam Sadler. They've walked us through some of the most important points relating to joint pain and possible replacement. Thank you also to our audience for being here today and providing us with such insightful questions, which we'll get to later in the show. And of course, to our patient participants whose stories you're hearing throughout the episode, we thank you. Let's go in more depth and talk a little bit about some options. Dr. Carolyn, what can cause joint pain, and is there anything you can do to avoid it in the first place?
Well, there are a lot of different causes for patients to have pain in their joints, and one of the things we strive to do is determine what the diagnosis is, because then it leads to the options we have available to treat the symptoms which are presented by the joint problem.
There are everything ranging from just simple overuse inflammation of a joint that is not structurally incompetent, all the way up to degenerative changes which have then changed the actual function of the joint structurally.
But what about, you see obviously some younger people and kids, but of course you think of joint replacement and you think of maybe the aging population. Is there anything that can be done earlier in life to help avoid needing a joint replacement in the first place?
Sure, well, some of it is determined by the genetic composition of your articular cartilage, or the nice smooth shiny white stuff on the end of your bones. That can deteriorate over time. We do know the best way to help prevent that is to lead a healthy lifestyle. Being close to ideal body weight, possibly have an appropriate diet that avoids certain types of foods that may lead to these problems, and avoid traumatic injury to the joints. It would be probably the best way to avoid long-term joint problems.
Excellent. So Dr. Banzoff, what kinds of medications can be used if a person's experiencing joint pain? Is medication their first step, and what kinds of medications would you suggest?
Medications are a good first step. Usually we start with the anti-inflammatory medications, so like Advil, Aleve, things people can try over the counter. If they come into the office, we sometimes talk about prescription anti-inflammatory medications. Tylenol is also a good option, or acetaminophen. Sometimes we'll do a short course of oral steroids, but usually that is a good place to start. And like I said, the medications that are anti-inflammatory tend to work best for both pain and swelling, so they help to relieve the symptoms the best.
So in addition to inflammation management, what about the role of physical therapy? Does that play a role in preventative care, and does it also play a role post-operatively if a person does need surgery?
We see physical therapy playing a large role both preoperatively and postoperatively. Preoperatively, we find that physical therapy helps strengthen the muscles around the joint that's in question or in pain, and that allows the joint to move more freely, more controlled, ultimately eliminating the painful parts of motion. Postoperatively, it is essential that physical therapy plays a large role in the postoperative rehabilitation and recovery to get their motion back after the surgery is performed.
So we've talked about a few ways that you can possibly avoid surgery: physical therapy, inflammation management, even cortisone type shots. But what about if you need surgery? Dr. Carolyn, we saw from a patient profile that we showed earlier that shoulder surgery has come a really long way. Can you tell us what's involved in shoulder reconstruction surgery, and really what's the difference between shoulder surgery 10 years ago and shoulder surgery today?
Well, there are a variety of different ways we can reconstruct a patient's shoulders. If patients have degenerative change or osteoarthritis that's leading to symptoms that cannot be controlled with the non-operative measures that we talked about, such as injections, physical therapy, the anti-inflammatories, and modifying their activities, there are good surgical options available today that really were not even available more than 13 years ago.
And patients must come in and they haven't been able to lift their arm for years, and all of a sudden they've got full mobility back. It really must be an amazing feeling.
Yeah, it's pretty rewarding to be able to help someone regain really pain control, which is what we try to do, I think, in our day in, day out practices, is help patients control their pain. Pain is a very individual thing, and some people experience it completely differently than others, but it can affect their lives. So being able to provide them with some sort of intervention to help them in that way is a very rewarding and direct way we can help patients.
Dr. Banzoff, you see a lot of knee patients, and I know that my dad had his knee replaced like 25 years ago, and it was very successful, but it was a huge recovery. He was 2 weeks in rehab, and just a long time getting back on his feet. What options do people have today? What does a knee replacement look like in 2017, and how soon are people back to their life?
We've made a lot of advancements in total joint replacement, not only in the hardware that we use, but also in just our whole approach to it. The whole process is a lot more streamlined. It's a lot more centered on getting people up and getting people moving. We start with the physical therapy ahead of time, getting them moving, really working on the range of motion, and that also kind of plays out into the post-operative experience, or the time after surgery. And we're really focused on getting people up out of bed the next day. They're working with physical therapy right away, and we take into account their what they have at home, if they have stairs and any kind of obstacles there, and we get them working on that right away, so we can get them back at home, back at living their lives and doing the activities they love to do.
It's so impressive to see that patients can go through such a major surgery and really be on their feet the first day.
Absolutely.
So this is great information, but we're not done yet. After the break, we'll find out what anterior hip replacement is and when it's the appropriate course of action. You're watching St. Luke's Health Now.
total knee replacement, and it was done at St. Luke's Orthopedic Care. I've always been active my entire life, and I always had knee problems. I started a couple of years ago feeling that pain. It was something that I knew I had to start looking at to, get it taken care of. And the biggest thing right now is my son's getting married in June, so I can, dance with him on the dance floor. So I'm really excited. The surgery has given me a lease on life. I don't have to worry that I'm in the middle of the woods walking my dog somewhere and all of a sudden my knee goes out. I would tell anybody to go to St. Luke's. The staff was amazing. The doctors know their stuff. If you're having pain in your knee and you do need a knee replacement, go get it done. To me, it's just life-changing.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an exciting show tonight. We're talking about joint pain, non-surgical treatment options, and replacement techniques with a panel of highly trained experts. We're hearing patient stories of success and taking questions from our live studio audience. In case you're just tuning in, our panel consists of 3 orthopedic surgeons from St. Luke's University Health Network, Dr. Greg Carolyn, Dr. Jennifer Banzoff, and Dr. Adam Sadler. Thank you all for being here. In the first part of the program, we established what joint pain is, what some of the symptoms are, and some medical treatments. But we want to discuss some more specific options for people. Dr. Sadler, what is hip replacement, and what are some of the different approaches you can take in the operating room?
So a hip replacement is when the cartilage of the ball and socket joint of the hip is worn out and the patient is continuing to experience pain after conservative treatments have been pursued. Ultimately, when the conservative treatments don't work anymore, it's time to have the hip replaced. So we take out the bad ball and the bad socket with the diseased cartilage and replace that with prosthetic implants that provide free, painless motions. There have been multiple approaches described over time to do the surgery, both from the front, from the back, and from the side. The recent resurgence of the popularity of the anterior hip approach is something exciting, and I enjoy bringing to the New Jersey market, especially on the Phillipsburg side.
Excellent. And how's the recovery from that? Does that improve recovery time for patients?
So typically our joint replacement patients are staying 1 to 2 days after surgery in the hospital. I can say from experience that our anterior hip replacement patients tend to leave a little bit earlier than some of the other joint replacement patients because it typically is a muscle sparing or a muscle friendly type of approach compared to some others.
So they're experiencing a little less damage from the surgery in the other parts of their body to help them recover faster?
Yes.
Dr. Carolyn, how important is it to you to take the approach with your patients to try other things before you get to surgery? And how often is surgery the only option?
Well, it's rarely the only option, Ashley. I think the most important thing that I was trained and I try to explain to my patients is that it's really up to the patient to determine when they need to be more aggressive with the approach. Surgery can always have problems, so we do try to avoid it if at all possible. When patients feel that their activities of daily living are being affected and they're not being controlled with the non-operative measures, when they feel that their personal relationships are being affected by the pain they're experiencing or their work relationships are being affected, that is a time to really discuss in more depth the options of shoulder replacement or hip or knee replacement.
Dr. Sadler, what do you find patients come to you as one of their main concerns when they're considering their options? You talked about this personalized approach and having them play a role. What do you hear most regularly as their concerns when they're thinking about, are they going down the route of physical therapy and inflammation management, or are they going to go for the surgery?
I tend to listen to my patients' requests in terms of what they feel will help them relieve their discomfort and also help them restore their goals or their level of activity. So that varies for everyone. So some people will start more conservative, some people will tend to prefer to jump in to get more aggressive because they have an upcoming marathon they want to run or half marathon, or they just want to go on vacation. So
I think we spoke with a patient that just wanted to be able to dance at her son's wedding.
Exactly. So, it was important to tailor the treatment to what that patient was having as in terms of an expectation and return to function.
Dr. Banzoff, Dr. Carolyn had mentioned that this is really a team approach. How does the team at St. Luke's Orthopedic Care and really the team at the whole St. Luke's network work together to communicate for the best care and outcome for your patients?
It's very much a team approach. We work with really all the doctors at St. Luke's, starting from the primary care physician to if the cardiologist is involved. We really try to communicate with all the doctors in order to best provide for our patients. It's easy to communicate with them with our computer system. We can see each other's notes that we write. It's also easy to pick up the phone and call them. We all are very easy to get a hold of, and we're always happy to contribute and help in any way with our patient care.
Dr. Carolyn, what do you think is the most important thing that you want patients to know who are experiencing joint pain and maybe haven't sought professional medical advice yet?
Well, I think the most important thing is something that makes me very happy to go to work, is that we have options to help patients' symptoms. And the saddest thing I see is when patients are afraid to be treated for their symptoms, because we can help them in the majority of cases. Not every case, unfortunately, can be treated fully, but I hate the idea of people living in pain when they really don't have to be. Now, of course, there's different gradations to how aggressive the treatment should be, but at least establish the diagnosis by discussing it with your primary doctor or seeing a specialist, and then understanding what are the best options in order to help you live a life that you that you enjoy living, do things you want to do, go to your dance at your son's wedding, go on vacation, return to a state playoff championship. There's all different levels that people live, and it's just sad when I hear about people not wanting to seek treatment.
Well, we're so grateful to all of you for being here to tell us that there are those options out there and to give hope to our audience. So we want to thank you for such an informative conversation. Up next, we're going to take questions from our live studio audience. Stick with us. You're watching St. Luke's Health Now.
Over the last few months leading up to my visit, I was experiencing bouts of pain, not constant, not severe, but enough to limit my activities. When I first came into the office to see Dr. Sadler, I was getting ready to leave on a vacation, so time was sort of the essence. After listening to my story about my pain, we decided to try a shot of cortisone in the knee, since I was not going to be available to start physical therapy for quite a while. I know getting older, sometimes joints need to be replaced, so I was very hopeful that this wasn't severe enough that it would lead to that. Again, knowing I'm active and I could handle that situation, we did try some anti-inflammatories and physical therapy together, which definitely improved my situation. St. Luke's is the best place for anybody to go with any type of orthopedic pain.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to all of our audience members, but especially our patients, for sharing their stories with us. And of course, to our wonderful panel, Drs. Carolyn, Benzoff, and Sadler. We've had a great discussion on joints, and now we want to take some questions from our audience. All right, up first, we have a question that says, should you go for a partial knee replacement or a full knee replacement, and what are the advantages to each?
Whether you go for a partial knee replacement or a full knee replacement depends on your individual knee. Usually we consider a partial knee replacement in somebody who only has arthritis in one compartment of the knee. So the knee is made of 3 compartments, and really when you only have arthritis localized to one area is when we consider you for a partial knee replacement. And really then if you have arthritis in 2 or 3 compartments, then you're going to do better with a total knee replacement.
And that way you're not possibly coming back after a partial for a full anyway.
Exactly.
So Dr. Sadler, someone here asks, how soon do you need to exercise after knee surgery? How important is it to get back to exercising?
It's incredibly important. We actually have our patients get up the day of surgery. They're up walking with physical therapy and getting mobile again. There is a rehabilitation process that occurs for a few weeks to months, depending on your individual needs. I typically tell my patients that they can get back to activities or exercise around the 3 to 4 month mark, depending on what activity they'd like to get back to, whether that's just getting into the gym, getting back to the doubles tennis court, or getting back to the golf course.
Dr. Benzoff, we have someone here who said that she had arthroscopic surgery 10 years ago, and since then she's tried a lot of different medications, and some have helped for a while, but that she's not sure if she can continue getting cortisone shots. Is there a shelf life on that?
So I always tell my patients when we do cortisone injections that there's no specific limit to the number that they can have, but we can't do them any sooner than 3 months. So we have to wait a 3-month time period between doing the injections in order to safely administer them.
But if you've waited the 3 months, you can keep
Good to-
coming back.
Yes, yes, I think so.
Okay, good to know. Dr. Sadler, knee replacement. What precautions need to be taken so as to get the greatest longevity of usefulness?
That's a great question, Ashley. So with our technology that we have and the implants that we're using, we can expect in the ideal weight patient with moderate activity and looking out 20 years, we can expect excellent survivorship from them. So things you can do to get the most out of your knee replacement: maintain an appropriate body weight, try to limit your high impact activities such as frequent running or jumping or things like CrossFit people are enjoying doing these days. You want to maintain what's called low impact activity and sticking to a healthy lifestyle. That will help you get the longevity out of the joint you're looking for.
That's great, and that really is a really long time that a joint works nowadays. Dr. Sadler, last question we have here this evening is, at what age should I contemplate joint replacement?
I think that age is constantly in flux because we look at the history of joint replacement and the people that were getting them, and they were typically older and older patients. But I think we're seeing people stay active longer and higher level of activity sooner. That line is starting to creep up into the 50s, and replacing someone's joint at 50 or 55 is not unheard of these days if it's well indicated. So again, I think it's important to look at every patient individually, their specific needs, and how severe their disease is.
Thank you guys so much for being here. We learned a lot tonight and we really value your expertise. We're also so appreciative to our studio audience and for our patients for giving us their stories. For more information on joint health or any related orthopedic topic at St. Luke's University Health Network, please visit their website at sluhn.org or call them at 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.